Can accessing medical records reveal CFS misdiagnoses? Imagine having a detailed map of your health journey at your fingertips. Medical records are just that. They hold a wealth of information about your symptoms, tests, and doctor's notes. When it comes to chronic fatigue syndrome or myalgic encephalomyelitis, these records can be a valuable tool to check if the diagnosis was accurate or if other conditions might have been overlooked. Research shows that nearly half of patients initially diagnosed with CFS or ME by general practitioners are later found to have different or additional health issues after seeing specialists. These can include other chronic illnesses that cause fatigue, sleep disorders, hormonal or nutritional problems, heart issues, or mental health conditions like depression or anxiety. This means that the initial diagnosis in the medical record might not always be the full story. It's also important to note that psychiatric conditions are sometimes missed rather than misdiagnosed. Studies indicate that doctors in clinics often overlook coexisting mental health issues that could explain fatigue symptoms. Reviewing medical records can help identify if these conditions were present but not documented, which is crucial for understanding the true cause of symptoms. Medical records often contain diagnostic codes, like those from the International Classification of Diseases, and detailed clinical notes. By examining these, patients or advocates can spot inconsistencies or see if a diagnosis has changed over time. This process can reveal if a previous diagnosis of CFS or ME was based on incomplete information, or if new symptoms led to a different understanding. Having access to complete medical records empowers patients to advocate for themselves. It allows them to ask questions, seek second opinions, or request further testing. This is especially helpful because symptoms of CFS or ME often overlap with other conditions, making accurate diagnosis challenging. Of course, reviewing medical records isn't a substitute for professional medical advice. The quality of the records depends on thorough assessments and specialist input. Sometimes, misdiagnoses happen because evaluations were incomplete. That's why it's always best to work with healthcare providers when interpreting these records. Remember, access to your medical records is protected by privacy laws, but you have the right to review and understand your health information. In summary, medical records are a powerful resource for uncovering potential misdiagnoses related to chronic fatigue syndrome or myalgic encephalomyelitis. They provide a detailed history that can help identify overlooked or incorrect diagnoses, guiding better treatment and management. Always consult healthcare professionals for personalized advice and use your records as a tool to better understand your health journey.